Hello, this is Ping. Today I'm presenting my Advanced Care Planning Community Education Project for Chinese Americans. Medical crisis can happen at any age and resulting a person too sick to make one's own medical decisions. Sometimes patients are kept alive and may receive futile and costly medical intervention because of incapacity or lack of previous discussion for treatment preferences. With the increase in the aging population and advancement in life-sustaining medical technologies, more people are facing difficult medical choices near the end of life. Healthcare providers and family members often encounter difficult situations in making treatment choice for the very ill patients who lack the capacity to communicate treatment decisions. Advanced care planning is an important step to ensure each person gets medical care as one wishes. Advanced directive can not only ensure personal autonomy, decrease the decision-making burden for family and healthcare providers, also improve the quality of life during the end-of-life care and reduce healthcare costs. Despite the benefits of the advanced directive, the completion rate among the U.S. general population still remains low, around one-third. And this rate is even lower in ethnicity minority groups, including Chinese Americans. Why is there the gap? So in traditional Chinese culture, death was sensitive and used to be avoided during family conversation due to concern of bad luck. Many Chinese families prefer not to share bad news regarding diagnosis or prognosis with the patient, which further delays advanced care planning discussions. But research also found most Chinese are in favor of medical autonomy and comfort measures for irreversible health conditions. During the literature review, I identified 3 interventional studies regarding this topic, and they have all proved that nurse-led, community-based, culturally tailored advanced directive education program can promote advanced directive acceptance and completion. But I think more research needs to be done to confirm and support this finding. So this is the outline of my education project, including preparation, intervention, and evaluation. During preparation, I developed the PICO question, reviewed the evidence-based practice literature, identify the education material I'm going to use for the seminar, prepare the PowerPoint presentation slides, identify the measurement tools. The project needs to be approved by IRB before implementation, and I also need to do a resource cost analysis. My PICO question is, among the adult Chinese Americans in the community setting, how does group education seminar on advanced directive compared to without education seminar affect the acceptance and implementation of advanced directive? There are 2 major variables I'm going to measure. The first one is called ADQ, which is Advanced Directive Questionnaire. The other one is ADAS, the Advanced Directive Attitude Scale. I plan to measure both variables at the beginning of the education workshop, right after the workshop, and 1 month after the workshop with a follow-up session. Of course, I'm going to also collect the basic demographic data at the beginning of the education workshop. I also need to do the cost analysis, including infrastructure, staff education, and implementation. I'm going to focus on the implementation part as my presentation. So for now, I plan to do 2 workshops. One is during the weekday, the other one is during the weekend. I plan to use a community, a public library meeting room, or church meeting room for the presentation. My target population is Chinese Americans in the local community, church, and neighborhood. I'm going to be the person who leads the education seminar, and it will be carried in both English and Mandarin, and the content will be culturally tailored. After the implementation, I'm going to collect data and also carry statistical analysis, review the study limitation, and draw the final conclusion. My goal of this study is hoping to improve the advanced directive awareness, knowledge, and acceptance in Chinese American population and continue facilitate ongoing open communication in the community after education. I also plan to disseminate my findings by poster presentation and submitting my report to peer-reviewed journal. So this is the outline of my EBP project. Thank you for your attention, and if you have any questions, feel free to contact me. Here's a list of the reference I use for this presentation, and here's the special credits I want to give to the PowerPoint template and the picture I use for this presentation. Thank you.